I'm Lauren Listowskis. I'm the program director for Grit Health. I'm a cervical cancer survivor, and I'm excited to bring this program to you today. So, since this is a program, we will be recording today so that we can make this recording available so you can rewatch it later, or if people were unable to join us live, they can view the recorded version. In addition to that, we will be sending you all an email. Everyone who registered will actually get an email in about a week or two when this recording is actually up on our website. And we'll also work hard to get you guys a summary blog emailed to you as well and get that on our website too. So all the information, if you miss something or someone said something great and you didn't catch it, that's okay. We will get you the information and resources. So it is up to you if you want to be on video, off video. I ask that you stay muted most of the time unless it's time to open up for questions. But for questions, what's most helpful is if you actually open up your chat and make sure your chat is addressed to everyone. And if you want to send me a private message, you can select my name only. But the chat is how we're going to be taking questions tonight. So we're going to be going back and forth in some conversation with our awesome speakers. And I will pause every once in a while to go through the chat to get those questions. So I wanted to also let you know this is all informational. We're here to just provide you information to help you make the decisions about your healthcare and your journey. We're not going to be giving any medical advice or going over personalized questions. We'll try our best to get through questions, but we're all on the spot and live. So if we can't answer things, we will try our best to follow up with that afterwards. But I'm excited and I'm thankful everyone is here. And on that note, we can go ahead and get started. If you see me looking around, I'm doing the whole 2-screen thing. It's new to me and it's exciting. So our program tonight is brought to you by one of our partners, ASCP Patient Champions, and ASCP is the American Society for Clinical Pathology, and Patient Champions is a piece of them and works through advocacy, taking patients, survivors, not only cancer, but all types of diseases. So we have a couple of really great speakers. We have Carly, who is a cancer survivor, who actually works in healthcare and is really a passionate advocate, and she's a patient champion with ASCP. We also have Dee Dee with us today, who is another advocate and patient champion with ASCP, who has been a caregiver to multiple people and has also gone through 3 life-changing diagnoses herself. And then we also have Dr. Hellborn on with us today, who is a pathologist in California. He was a past president of ASCP, and he serves on the Patient Champion Steering Committee and helps out with really getting the message out of we need to understand our labs and why it's important to understand your lab reports and pathology reports. So with that being said, thank you all for being here. Thank you to ASCP Patient Champions. We will just jump right in with some questions for these great speakers. So I will start off with Carly. Can you tell me a little bit about your story and your personal connection to cancer?
Sure. So I was diagnosed with stage 1 papillary thyroid cancer in January of 2017. I had my first surgery 5 months later because it took me that long to see a doctor. And then I had metastases, which were found through my pathology results. So there you go. And so I had to have a second surgery and a round of radioactive iodine, which is radiation. That is oral. And then this year in February, I was told that the radiation did not kill all of my cancer. My cancer did not respond to the radiation. So I was diagnosed with cancer again in February of this year, and I had my third surgery 2 months ago.
Thank you for sharing. I hope you're doing well and feeling well today.
Thank you.
We're happy to have you here. Dee Dee, could you tell us a little bit about your story and your connection to cancer?
Sure. My first connection to cancer was through my mother, who had chronic lymphocytic leukemia, and I was her caregiver. And then shortly before she passed away, I was diagnosed with chronic lymphocytic leukemia, and so I was diagnosed with kidney cancer, with renal cell carcinoma. I had the surgery for that, had a partial nephrectomy, and about 10 months later, I was diagnosed with a brain tumor and had another surgery for the brain tumor. Went through a lot of issues with that, ended up with seizures for a year, and on anti-seizure medication. I'm now off that, and then 3 years later, I was diagnosed with the CLL, and my brother also was diagnosed with CLL. So my mother, myself, and my brother all had or have it. I was also connected with my partner, who was quite ill in his last 5 years, and was caregiver for him. So those are all my connections with cancer and caregiving, and all of that has been since 2008.
As I'm muted, there we go. Thank you for sharing that, Dee Dee. And Dr. Hilborn, if you could just tell us a little bit about yourself and what you do, and then kind of tell us a little bit more about ASCP and the Patient Champion Program.
Sure, I'm happy to, and good evening, everybody. It's certainly a pleasure to be here with my Patient Champion colleagues represent ASCP. By training, I'm a pathologist, so I'm one of those guys who runs the lab, and I bet many of you who were just regular in the community kind of people didn't know much about the kinds of things that we do. You know, we do biopsies and make diagnoses, so the things that Carly and Dee Dee talked about, we will look at cells and make diagnoses, but we also run the clinical lab that does blood work. And again, many of you often take the lab for granted, and that's because we do a pretty darn good job of getting reasonable lab results out. And I suspect that probably very few of you knew what PCR meant until last year. And now all of a sudden, everybody seems to know what PCR is because of COVID. And when the important thing, ASCP is a nonprofit professional organization of both pathologists, people like me, the physician members of the laboratory team, and other laboratory professionals, primarily medical technologists or clinical laboratory scientists, cytopathologists, and others. So collectively, there's a huge group of people. We are the largest organization in the United States and probably the world that's devoted to really improving patient care through improving laboratory medicine. And one of the key activities that ASCP has launched into is really to work together with patients and with the public so that there's a broader appreciation of laboratory medicine. We were talking about that actually this morning because everybody came to appreciate how important laboratory medicine was in the peak of the pandemic when it was so hard initially to get a test. And people appreciated the laboratory, everybody. And so it's really important that we think we keep that initiative going to the future. So that's a little bit about ASCP, a little bit of pathology, and you know, I think that ASCP will be a great. I see where it's translating it. It always translates ASCP into ASAP. So it's ASCP, the American Society for Clinical Pathology. And their website has information. You can see some of the patient champion stories, including the individuals that were here this evening. And I'm just interested in having a discussion going forward. I've talked too much.
Thank you, Dr. Hilborn. And yes, I didn't catch in the beginning, but I did turn on transcripts. So for those of you that might need auto captions, it'll try its best. It's there. But yes, ASCP, that's right. Thank you for sharing. And you're absolutely right that one of the first times we've really heard more about the lab and understood the lab is now because of COVID and everything in the news about things like PCR. So I'm hoping that one great thing from COVID can be that we continue learning about the lab and really engaging the lab a lot more and appreciating you guys as lab staff too, who often aren't thought about. So thank you.
We kind of think that the entire lab team are sort of the unsung heroes of healthcare. More clinical decisions are based off of the lab, but very rarely do patients have that opportunity to interact with lab staff. So,
yes, you're exactly right. Carly, could you tell me a little bit about kind of how you got involved with ASCP and the Patient Champion program?
Sure. So as a result of my diagnoses, I have really wanted to get into patient advocacy. And ASCP was just something that I happened to find. And so when I talked to somebody about it, they had asked me what was my experience with pathology in the lab. And I said, oh my goodness, that is literally what my diagnosis is based on. And it determines so much in terms of if I relapse, if I'm refractory, meaning it didn't respond to treatment. And so I knew I had a lot to say. And so that's how I kind of got involved. And I really enjoy sharing the importance of the lab, especially for my type of cancer, and all the biomarkers that come along with it and the different types of lab tests that are needed to determine how much more treatment you need or don't need. So yeah, I would say that has been my experience so far.
That's great. Thank you. And Dee Dee, could you tell us a little bit about how you got involved with ASCP and the Patient Champion program?
Sure. In 2007, I was told about the what was then the Board of Governors for the Board of Certification for the ASCP, which is a nonprofit branch of the ASCP that does Lee, you can say it better than I do, that does the credentialing for the laboratory scientists. And I became their public member. And I knew nothing. I was just in awe to sit in these boardrooms with all these scientists, and my job was to represent the public. And during that time, I was struck with the fact that I'm just one person, and I learned during that time the value of the lab, and I wasn't sick yet. And I also learned at that time the quality of the people behind the lab and their dedication to the laboratory scientists and how the important role that plays in all of our lives, literally all of our lives. And I was so struck by it, and my feeling was that, I'm one person that was fortunate enough to have this opportunity to meet these people and to learn from them and to sit through these long meetings, but was engrossed in what they were saying and realized that this was, behind the scenes in every single disease, every single issue that we have in healthcare. And I became very, I wanted to tell the story. I wanted other people to know how important this is. And then I got sick. And so then I became a person that really needed the lab. And so I served on that board for 9 years. And just before I was leaving the board, I was diagnosed with the CLL. And of course, with CLL, my life now depends on the lab. And so I get my blood tests every 3 months, and I can't wait to get the results to see how it is. But anyway, I was leaving, and they were this Patient Champion program was a concept, and it was just being launched. And so myself and another person who has since passed away, sadly, that was on that board, became two of the first patient champions in this program. And when they came from Chicago, from where ASCP is, to Boston, where I live, to do a video of me about my story, part of that video was to interview my pathologist. And I mean, did I know that this person was such a big part of my life? I had no clue, even after the 9 years, and no clue. And yet they did this video, and they brought me into the lab and introduced me to my pathologist. And it was very emotional for me. This is the person that actually saw 4 years before I received the diagnosis, the change in my cells. She told me that my cells were changing 4 years before they brought it to me as a diagnosis. And after the video was done and she finished the interview, she asked me if I wanted to see my labs. And she brought me into her office and she put my blood work up on her computer screen, and she went back the 4 years. She went back 5 years. And she showed me my cells 5 years ago, and then she showed me my cells 4 years ago, and she said, see this, this, and this, and then a year later, see this, 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 and this. And my white count was going up during that time, and I was just enthralled with visually seeing and hearing this person tell me that she had been following it all this time. And it was mind-blowing. And when I left her that day, she was actually transferring to California. But when I left her that day, we both cried. And she cried and I cried. And we hugged each other. And she said, you are the first patient. I've been doing this for 12 years, and you were the first patient that I've met. And that really struck me. And I thought, wow. I mean, I learned so much from her in a very short time, in a couple of hours. Learned so much about my own, I was going to say disability, but my own cancer in a short time. And it was life-changing for me. And so now for my brother, I keep saying, you need to talk to the pathologist. You need to learn what you have. And I say it all the time to anybody that will listen. So isn't this a great opportunity? And I echo what Lee said, and in that I learned in being on that board how much goes into it, how careful these laboratory scientists are, and how much knowledge they have, and how much our lives depend on that knowledge, and how dedicated they are. And it gave me so much more confidence in life, really.
And I'll say that I had the pleasure of serving on that board of certification with Dee Dee. So not only were we co-members of the board of certification at the same time, but we also became friends. So it's been great. And she was a terrific public member, tough act to follow when her 9 years were up. So I think we were very lucky. And the Board of Certification, actually, just by way of background, was originally called the Board of Registry. And it was created a few years after ASCP was created. And ASCP will celebrate its 100th year coming up pretty soon. And it was created a few years later. It was a pathologist organization that was focused on quality. And then ASCP, the pathologists, created the Board of Certification to provide a professional standard for laboratory professionals, and has been certifying laboratory professionals ever since. People who work in the clinical, in the chemistry laboratory, the hematology laboratory, the cytotechnologists, the histotechnologists who prepare the slides, the microbiologists, the blood bankers, etc. So when there's an interest in having strong quality, people now turn to ASCP and ASCP certified laboratory professionals.
Thank you for sharing that.
And congratulations and thank you to the individual who indicated that she's a member.
Yeah, Sandy, thank you. And Dee Dee, such an incredible story. I know the first time I met you and talked to you, I was just blown away by your story and the moment and connection you were able to have with your pathologist. And so kind of on that note, like you said, you didn't even know you could get in touch with a pathologist or anything like that. So I was wondering, either of you, Dee Dee, Lee, or Carly, how can somebody get in touch with a pathologist and talk to them?
Well, maybe I can start and others can follow. There's several routes, right? It also depends on where your laboratory is based, right? If you're in a healthcare system like we are, let's say at UCLA, that you can reach out to the laboratory at UCLA. If you're in a community physician, they may send their laboratory specimens to a reference laboratory like Quest Diagnostics or LabCorp, ARUP, Mayo, et cetera. So, one of the things is to look at your lab report and figure out, because it will say on there where the test was done, and also who the laboratory director is, because those are required reporting by law. Probably the best thing to do would be to ask your physician who ordered the test to say, I'd like to know a little bit more. I'd like to reach out to my pathologist. Do you know the people in the lab? And many of them will, particularly in hospital systems. And then if you get a positive response, I'd reach out. If you don't, then there's nothing to preclude reaching out to. Lots of us are pretty friendly people. We're just like everybody else, I hope, and would be happy to talk to individuals in the community. I think that pathologists are a little bit reluctant to give direct medical advice because often we don't have the whole picture. And so that's why we primarily give the information to the treating physician who pulls it together with the other information, the x-rays, the other lab results, and so on. But general information, we're happy to provide. And guidance and explain things, just as Dee Dee explained, that her pathologist was able to provide her some instruction on what on her diagnosis and what the pathologist found.
Yeah, that makes complete sense that, we have to remember that the lab and pathologists are a piece of your healthcare team, that they primarily go directly to your providers, your doctors, because your doctor has, known your whole kit and caboodle, your whole story, the whole time they've been treating you, and every little scan that's been done and this and that, and they kind of put all the pieces together, and the lab is able to give them the information they need and their advisement that they need, and then they relay it to you. So that's helpful information. And as you all know, if you've come to Grit Health programs, you know that we're always telling you to be your own advocate, to just ask questions. The worst thing you can do, like you said, Lee, is if you don't get a positive response, then go around it and find a different way to get your answers. What's the worst that can happen? You're told no. So then you keep trying, you bug other people. You'll get an answer eventually from someone.
Yeah. Can I say?
Keep asking until you get to yes.
Yes. I have two examples of that. When I was diagnosed with the renal cell, and I was in the process of moving at the time, and I didn't know where to go, and I had never had cancer, obviously, before, and I had gone through a lot with my mother, and couldn't get answers, and I didn't know how to ask the questions, and then what I ended up doing is getting 5 different opinions. I went to 5 different hospitals in Boston and got 5 different opinions, and 4 of those 5 opinions were different, and which I couldn't believe. I was just amazed, and so that was one piece of it, and then when I got diagnosed with the CLL, I didn't really understand it until I got to see those slides and saw the changes in the cells. I didn't get it. And when I saw the changes in the cells and then all of a sudden it was like, I call it a Helen Keller moment. It was just like, I just understood what my issues were. And it made all the difference. And my brother has it, and I'm able to help him now, which makes me very, very happy. So it's just being able to, and I was lucky that I had the opportunity to meet the pathologist. But now like as Lee said, now it's a, if I want to talk to the pathologist, I'm not going to give up until I actually get a pathologist to talk to. So to find out about my issues.
Great. Yeah, thank you. Carly?
Hi, yes. So with me, I have in addition to labs, I have an annual ultrasound every year on my neck. That's where your thyroid is located. And that's how both of my tumors were found. And when they found it on the scan, an FNA, which is a fine needle aspiration biopsy, was immediately ordered and done the exact same day. And so I was with a radiologist, and another doctor came in to help them with a biopsy. They didn't introduce themselves to me as a pathologist, but I did want to say they were, because he said, okay, I'm going to help her do this, but then I'm going to go back to the lab and I'm going to review the slides, and I'll come back to you and I'll tell you what my findings are. And so that was kind of my experience with understanding where my diagnosis came from. And of course, when you hear cancer, your mind just goes blank, especially if you're getting it for a second time. And so I didn't really even think to ask about, okay, well, what led you to that decision? Like, I don't mean to like undermine them, but I thank you for sharing that, Dr. Hilborn, and to Dee Dee, because I wouldn't have known. I just kind of accepted it as it was, as a diagnosis, and I said I want it out immediately. You know, I didn't even think twice about asking for a second opinion on the cells, or, you know, having them sent to another place. All I knew was I had cancer, and then I had cancer again, and I just wanted it out. And I was done. I was like, I don't care. You told me I have cancer. I have it again. Just get rid of it, and so I can be done with it. But I see from your examples that it is so important to understand that and to get a second opinion if needed, and to ask who the pathologists are, and help provide you information, because they are part of a care team, but they're not really recognized as such. You know, you think you go to the lab and then it's over. All you do is you're waiting for your results, and there's a term with getting scans called scanxiety, which I have every single time. And then there has to be something for labs. I don't know, lab anxiety that I also have. Because every time I have to get, you know, labs done, and, you know, the mortals among us, the non-cancer patients, they don't really understand the ramifications of it when we go to get our labs and our scans done, because they can say, this was, you know, it was told to me by my parents. They were like, why do you have so much anxiety when you've done this so many times before and you've been okay in the past? And then when my scan happened this year, I can say that's why, because it didn't respond to radiation. It showed up on a scan. I'm having more treatment done, and my scanxiety, my lab anxiety is warranted every single time, no matter how many times I have to go through it.
Well, I think an important message is we understand that from the laboratory provider standpoint.
Well, thank you.
Every specimen is a patient, right?
Yes.
And it's very important that it be done right, that it be done fast, and that it be done carefully. And so, you know, although I'm not going to stand in front of you all in a virtual sense and say that mistakes don't happen. But the laboratory and the laboratory processes are so incredibly clear now with regulation, with practices, with oversight, that in most cases, the kinds of errors that might happen in other parts of medicine don't happen in the lab. Doesn't mean it never happens. And then, as you said, Carly, the issue about maybe a second opinion, particularly with interpretive specimens, so the biopsies, the cytology, the pap smears, and items like that. If in fact it's not absolutely clear, it's probably worth asking for a second opinion. Not in every case if it's straightforward, but if there is lack of clarity, by all means.
And so on that, because we talk about getting second opinions, like I want a second opinion from a different oncologist. So we're talking about the actual reports and the pathologist that's interpreting it. Is that, because I know how hard it is to go and try and get a second or third opinion from different medical oncologists. Do you have any advice on how, if I got my report and I say, I kind of want somebody else to look at my little thing of cells here, how do I even do that?
Well, so there's kind of different, there's the general pathologists who do most things, but many of the academic centers have specialist pathologists. So there may be they likely have a GYN pathologist or a urogenital prostate pathologist or somebody a neuropathologist who only does, brain things or head and neck. So that one of the things, depending on where your specimen was looked at, you might ask if it's possible to get a second opinion from a specialist at one of the major academic centers. And it's probably fairly easy to look online and figure out, where there really are those experts. Dee isn't going to have any trouble in Boston because there's more high-end hospitals per square mile than probably anywhere else in the world. But I think the main thing is to look for a referral. And most of us, if we're practicing community pathologists, have a network of specialist pathologists, because if a community pathologist sees something they don't know, what are they going to do? They're going to send it out. And so most of the time that makes sense. The other thing is if you as you were saying, Warren, if you go to and ask for a second opinion, you'll probably be asked to bring your pathology with you. And at least, for example, at our institution, we always have that pathology looked at by our pathologists, because we'll get it's essentially a second opinion. Most of the time we agree. Every once in a while, honestly, we don't.
Right. Thank you. Yeah, Dee.
When they showed me, when they did the video, for the patient champion video, when I met my pathologist, the pathologist took us through these steps that each vial, each blood vial goes through before it's totally determined. And I was pretty impressed with that too, because there was a team of people in the lab that actually saw my slides, and that, some of them, obviously they were students, but it wasn't just one pathologist. It was run through a team of people, and which also gave me more confidence that, wow, this is, for me. All these people are doing this for me. That's how I felt. And I'm just one person. And obviously all these people are doing this for everybody. Who then, how many people is that? That's a lot of people. But it was pretty impressive, really.
Yeah, thank you for sharing that. All just really reassurance. And I'm just reiterating what Dr. Hilborn said, that the lab is such a regulated, defined process with rules and crazy rules, all kinds of rules. And that we're just with technology continuing to define those and get the lab better at what they're already good at doing. Oh, you're muted.
I see. Yeah. Importantly, that although it is very regulated, there's a really important reason for that. And that is if I see one of my doctors who's a community doctor who uses one of the reference labs, LabCorp, Quest Diagnostics, et cetera, and I'm going to go then to have my lab work done at the university hospital or the community hospital, I want to be fairly certain that the results I get from one place are going to look the same, more or less, as they do in others. It's not always an exact match, but the results are close, and that's why we control the process, not just within one lab, but across labs. And ASCP actually started that many years ago. They're a proficiency testing program, so laboratories could compare what they're doing. That's run now by the College of American Pathologists, but that program really was predicated on the fact that we want patients to be able to trust results irrespective of where they go.
Yeah, that makes sense. It's almost like, in simpler terms, all the different schools having the same grading scale. My A+ needs to be the same as your version of an A+. Because I know a lot of us, when you first start, getting tests done, it might be with your regular, primary care doctor who does send off, things to LabCorp or Quest, things like that. So absolutely needs to be the same kind of standards and looking at things the same way and regulating them that way. That makes complete sense. Just want to reiterate, if you guys have questions, well, a question just came in as I said it. Look at that. Jacqueline wrote, in your experience, was there ever a time when the pathology report indicated a cancer and the second opinion specialist in pathology determines otherwise?
So the answer is yes. That's why you often get it. Sometimes the diagnoses are really subtle. And when I read that question from Jacqueline, I reflected on one of my really good friends whose dad had a biopsy of something on his head. And the original pathologist said, I think that's cancer. And one of my colleagues who I trained with is one of the world's experts in head and neck pathology. And so I called him up. They, in fact, had some not direct relationship, but they knew people in common. And I asked my colleague if he would look at my friend's father's biopsy. And it was a very difficult biopsy because they're not all that black and white. But that's why this individual, who was an expert, looked at the very subtle findings and he said, here, this is why I think that this is not cancer. And I actually just talked to my friend, this is now several years ago. I just talked to my friend last week and he said his dad is doing well. So I think that the diagnosis that it wasn't cancer was correct. So the answer is yes. Especially if it's a subtle finding, there's no harm in getting a second opinion. Things that are clear and obvious, can usually trust those. And also the other thing is that in larger facilities where there's groups of pathologists, for things that are challenging, one pathologist will show it to another, right? Or several people, and we'll have conferences and everybody will look at the same thing at the same time to make sure. So those are the kinds of questions that are probably worth asking if you have questions about your biopsy.
Yeah, great point that, even though it may be one pathologist, that the work that is done within the lab and then even outside with your greater care team, it is very collaborative, especially when it gets confusing or hard or not quite sure. Everyone loves a tough thing to try and work out and figure out. So thank you for sharing that. Dee Dee or Carly, whoever wants to chime in first, just kind of wondering, do you have any advice on how can someone try to get more involved in understanding their pathology and laboratory reports?
Kylie, you want to go first?
Sure. Oh my gosh. So every time I get my lab results, I cannot remember what TSH and T3 and T4 mean because they're the opposite of hyperthyroidism and hypothyroidism. And so I have to like Google every single time, like what this means. It's kind of embarrassing. And I do want to ask my doctor about it, but they tend to come back and saying, well, it depends on the assay. I'm like, okay, we don't need to be using medical terms here. So I have used a couple of different resources to determine what my lab results mean besides my doctor. ThyCa is an organization for thyroid cancer patients, and they have a wealth of information on what your lab results can mean based on like your levels of T3, T4, and your TSH, especially after a partial or a complete thyroidectomy, which is the removal of your thyroid. I would also say American Cancer Society has been very helpful as well. But if you have a good relationship with your doctor, they should be able to explain the lab results to you, whether it be at an appointment or through your patient portal, to just explain it very clearly with what it means. Because with, our types of cancer with thyroid and leukemia and lymphoma, the lab results truly matter, and trying to understand them is crucial in terms of your diagnosis. And so knowing what those different terms mean, not necessarily the assays that they're using to classify these biomarkers in these lab results, but just getting the basics of what this means for you in terms of am I doing okay? Because I think that's ultimately what we want to know as patients. When we break it down, we want to know, are we doing okay? Are we doing anything wrong? Can we be doing anything different? And the lab results should be able to tell us that, and the doctor should be able to explain that clearly.
I think that's exactly right. I feel exactly the same way. I think one of the things that that we all suffer when we get a cancer diagnosis is not having the confidence not having confidence in ourselves and confidence in, am I doing the right thing? Are they doing the right thing? And being able to know exactly what it is that's going on in your body happens in the lab. And if you can learn that, even just getting the confidence that everything is being done that can be done, or that you're making an informed opinion rather than just taking one person's suggestion. My brother has CLL, and he had terrible pain last fall, and he ended up having tests and was diagnosed with lung cancer. And that they said had metastasized to his bones. And I said, you need to get another opinion. And we were all devastated because it sounded terrible. And he did. And he went to a specialist, and guess what? It was prostate cancer that had metastasized to his lungs and his bones. And it's treatable. And with prostate cancer, now he's on an immunotherapy cocktail, whatever it is. And he's been on it since January, and he's doing great. The pain's gone, his tumors are shrunk, and he's doing great. And he felt as though he had a death sentence back in October, November. But having the understanding is just so important, just mentally and emotionally for a person who has a cancer diagnosis, whatever that diagnosis may be.
Yeah, I think the one thing, the question is, if you have questions on tests, where do you go? And I think some people talked about the American Cancer Society. There's a couple of places to go that would be useful. There's a a site that is run by multiple organizations called labtestsonline.org, and you can look for those. You can look for your particular lab test, and it'll explain it to you. That it has both a public and a professional kind of interpretation. If you're interested about whether there's some decisions on a particular test or guidance, you might look at choosingwisely.org, which is run by the American Board of Internal Medicine Foundation, and ASCP is a key participant in that group. The other thing is, if you just want to know about a particular lab test, many of the laboratories have online descriptions of the tests. You'll find, with deeper explanation, either some of the major medical centers have that. Certainly all of the reference labs, ARUP, Quest, Mayo, LabCorp, all have online services, and you can just search for the test and it'll give you a little bit more information about that. Some of it may be technical and some of it may not be. So there's lots of places to go for information. And then some of the major teaching hospitals have also, have information, particularly in areas that they specialize in. So if you're looking about the disease, that's one way to put it together.
Great, thank you for sharing that. And I'll just kind of say, I know Google can be our best friend and our worst friend. So being careful when you're looking things up, and these resources that you all have mentioned, I'm definitely going to have those, in the blog. We're going to get those on the Grit Health website, because finding reliable information is very important. The internet is a black hole. You can find the best things and not the best things. Same with some support groups. You can get misinformation from other patients. So really making sure your source is reliable, and those medical-based societies and groups that curate this information, that's great. And also, different advocacy organizations that work specifically in that type of cancer. Advocacy organizations can be a great help in finding quality information. So thank you for that, Dr. Hilborn, Dee Dee, and Carly. We have a question from Nicole in the chat. What are some basic things if, we go on our patient portal or we get a printout and we see our labs? Are there any, our reports, are there key things we should look for, like things that stand out? Maybe my sugar was high one day or my sodium was a little bit high, but what are the things that are important?
So that's kind of an open-ended question, which is of course going to lead to an open-ended answer. So it really depends on what the test is. I mean, Lauren, you make a good point that if you're, say you had a routine blood specimen and the sugar was a little high, maybe you weren't fasting, maybe I'm looking at a jar of candy behind my computer. So maybe somebody sampled that before getting the test, or if you went to the local hamburger joint before you had your meal, your cholesterol or your blood lipids might be off. So I think one of the things to look at, one of the important things that we always tell people is if you get a result and you're not expecting that result from a regular lab test, now you're not going to go and have another biopsy, right? You might want a second opinion on the biopsy. In rare circumstances, you may want to repeat it if it's negative and maybe they missed the thing that they were looking for. But in a clinical lab, if you get a result you don't expect, the most intelligent thing to do is to repeat it first and not go down a rabbit hole that says you definitely have this condition. So one elevated blood sugar does not make somebody diabetic. Now, if you've had consistent elevated blood sugars, you've had consistent abnormal lab tests, then that's different. So a patient, like as Dee Dee was describing with CLL, there might have been some subtle findings that became a little bit less subtle over a period of time. And so my guess is those are the kinds of things that they're looking at. Like Dee Dee said, she goes and gets tested every 3 months, so that there's an opportunity to intervene early on. So trended data are really important. And so sometimes if you go to different doctors who use different systems, it behooves you to keep a record of those laboratory tests, because if you come now to a new doctor or one of your doctors and say, look, I've seen this information and it looks like it's changing. What does that mean? So I think that the most important question about what to look for is you look for differences, right? And trends over time. Some things you want to follow up with right away. You know, if you have a baby who has a lead level, you really want to deal with that immediately, right? Because you don't want somebody to develop, a newborn to develop lead poisoning. Now, if you have a subtle abnormality, a slight elevation in glucose, you may look at your hemoglobin A1C, a complementary test that tells similar information but slightly different. So you may look at confirmatory tests. If you have elevated liver function tests, you may want to have testing for hepatitis. So it's about triangulating, but the most important thing, if you get a result that you're not expecting, the first thing is to do is probably repeat it.
Yeah, always just kind of look for changes when things are changing. That's a good point. And then I know for cancer patients and survivors, we're always looking and waiting to hear about, our white blood cell count and watching that as an indicator of, how healthy our immune system is and what our body's doing. And I think everybody gets kind of different blood work done and different labs and pathology done based off of their unique diagnosis. But in general, what are some other things that we should pay attention to when we're either in treatment or out of, besides that white blood cell count?
Well, I think that's going to depend in part on what you what condition you're being treated for, right? There are studies there. If it's cancer, there are tumor markers that are relevant for certain types of cancer that may be followed. If they're going down, that's a good sign. If they start to creep up, it may show early recurrence, and that's an opportunity to intervene early. Jacqueline also said, being dehydrated also affects lab results. So that's right. So important thing, they often tell you to fast before you have your blood drawn, but fasting doesn't mean get dehydrated. So drinking plain water is something that you should do before you have your test. There are other things, like if they tell you make a fist and you make do it a lot, to pump up that vein, that actually raises some things like your potassium. So it's important to know some of the things that might influence those results. So I think the answer is, what tests are you getting? What are they being used for? Certainly the white count that you mentioned, Lauren, is often used because some of those chemotherapy drugs, not only do they attack the cancer, but they also attack the bone marrow. And you don't want to give more chemotherapy until the bone marrow has had a chance to recover. So that's looking for the body's general response. But I think the other question is, are there specific markers that are being followed for my particular condition?
Right, that makes sense. Because I know for my cancer and what I have, there might not be, certain tumor markers. So there's no reason to look for them. But, something like ovarian cancer, that definitely has, that tumor marker, that's something that they're probably always going to keep looking at. And that is where you pay attention to the changes. So.
And there are new molecular markers too. So pathology and diagnostic medicine is evolving to look for molecular diagnostics, which both improve the specificity of the diagnosis, and in some cases now with personalized medicine, can help specifically guide treatments.
Yes, exactly. And I know we're coming close to time and we're getting into some really scientific stuff that has a lot of potential and promise when it comes to treating different diseases and really making your survivorship count and getting you through things. So these things we're talking about here at the end are some things that we'll definitely try and throw into that follow-up blog. And I'll probably bug you, Dr. Hilborn, to just throw in a couple answers into a blog for me, for everyone. But thank you all so much. This was great. I learned a lot, and I hope everyone else did too. And I think ultimately we really learned that you need to empower yourself. It really is, this title of the program, empowering yourself is true. You need to ask the questions. You need to keep asking, like Dr. Hilborn said, until someone finally says, yes, let me help you. Keep asking till you get a yes, and keeping track of your labs, and not just, normal or abnormal, the actual levels. And that's something you can do that's easy for yourself, whether you print it out from the patient portal that you might have, or say, hey, can I get a printout of that and collect it? Keep your little booklet. If you ever have to move or change doctors, you have it right there. So it just makes everything easier on your end and their end.
An important point to mention is that you should only get the tests that you need. Because if you look at how do we define what people call normal, it's defined as that which 95% of the population, generally, that which 95% of the population fall into, of the healthy population. That means on a statistical basis alone, 5% of people have an abnormal lab result. 5% of healthy people have an abnormal lab result. So what happens if you order 20 tests? It is more likely that you're going to have on a statistical basis alone, have an abnormal result than have a perfectly normal complete distribution. So I often say the only people who are truly normal are the people who haven't had enough tests. So the important message there is don't go to the doctor and ask for everything, because in fact you can end up harming yourself. And I remember a friend whose brother, one of our technologists, came, and that was exactly the issue. He had an abnormal lab test. He never really needed that lab test. It was slightly abnormal. He was about to get a invasive biopsy for a condition that he never should have been tested for, because he might have been one of those 5% of people for whom that test is abnormal for them. And that's why often you're your own best reference more than the reference range.
Yep, that's exactly right. Because you don't want to ask for 50 different tests when you might only need 5 of them, because then you can really fall into a rabbit hole and, confuse things more and follow something that's maybe not even relevant. You have to focus on what's important, and exactly, you're your own reference. And I know something we always joke about in the cancer world is, your normal, my normal is totally different than a healthy person's normal. And that varies cancer types as well. So always kind of keeping that in mind. But we are at time, but thank you again to ASCP, the Patient Champions Program, on your team. I think Erica might be on, so thank you for helping get this set up. Carly, Dee Dee, Dr. Hilborn, thank you so much. Like I said, I will be getting a blog out, and we'll be posting the recording on the website so you can watch this again. My colleague Chris dropped a link in the chat for the ASCP Patient Champion Program, which that's going to be in, all the links will be in the email, so don't be in a mad dash to get them. Chris, if you could also just drop look at that, step ahead of me, grithealth.com/events, so you can register for our other upcoming events that are happening and just stay in the loop with what we have going on. Thank you again. This was great, because I know we wait, and as Carly said, this anxiety and the wait and the worry and the anxiety, and Dr. Hilborn getting to meet and talk to a pathologist like this who's so open, and know that you guys treat every specimen not as a specimen but as a patient is really good and important to hear as a cancer survivor. So thank you.